This is how you are going to find the trigger points, the painful knots and muscles on the inside of your partner's pelvic floor by learning what the tissue feels like on the outside first. First, you're going to palpate or touch your partner's upper back. Most people carry knots and stress and tension all up here in the upper back. This is an easy place to find knots and feel what trigger points feel like. So you're going to palpate, you're going to look for tissue that is stiff, restricted, it doesn't move well, it's probably painful and uncomfortable to touch, and it may even refer pain or send pain from one place to the other. So she has a big old trigger point right here, a knot. And this is the tissue that is stiff and restricted that you are going to be looking for on the inside. You're looking for these knots, and that when you push on them, they're uncomfortable. So here's how you feel what soft tissue feels like as opposed to stiff and restricted tissue. You can palpate your partner's arm. This tissue is soft, it's pliable, even in her forearm. A little bit of knot right there, but for the most part, okay, it moves well. As opposed to when we move up to the upper traps, the tissue is not pliable, it is stiff and restricted. So you are looking for this stiff and restricted tissue on the inside of her pelvic floor. Now that you know what the trigger points feel like, it's that tissue that is stiff, restricted, it doesn't move well, and it hurts when you push on it, often referring pain from one place to the other. You're going to look for that same sort of tissue on the inside of her pelvic floor. There are a lot of muscles inside the pelvic floor that refer pain from one place to the other in pregnant women. They can often feel that pain in their low back, in their sacrum, in their hip, or in the front of their lower abdomen. So here's what you're going to do. You're going to glove up. Then your partner is going to lay on her back. Then you're going to take your finger and you're going to insert. All right. You're going to take your time. What you're going to do first is just slowly scan. You're going to do like a general scan. Do the sides, do up at the top, and take your time. Again, you're looking and feeling for tissue that feels stiff and restricted and hurts when you push on it. Once you find like a spot or an area that feels like a knot or a trigger point, you're going to push down on it. You're going to start, pretty medium to firm pressure at first and see where she feels it. Does she feel that pain only where you're pushing, or does that pain refer somewhere else? And does it feel like the pain that she is describing? Ask her, do you feel that pain somewhere else? She may say it goes through her low back, or she may say it goes through her hip, or she may say she feels it in the front. You're in the right spot. Stay there. You're going to take your time. So what you're going to do after the general scan, you're going to push down for about 20 to 30 seconds and maintain medium pressure on that one spot. You're not moving at all. Then after about 30 seconds, you're going to do a little tiny massage just on that one knot, that one trigger point. All right. Again, medium pressured, what she can tolerate. After about a minute total, so 30 seconds of no movement, 30 seconds of little movement, you're going to move on. You're going to find a new spot. Just like you would on the outside, you're going to find a new trigger point to push on. Okay, you can spend about 10 minutes per side. You'll often find that when you switch sides, the tissue feels different from one side to the other. She'll probably have less pain on one side compared to the other. So again, maybe you spend 10 minutes on one side and just 5 minutes on the other. But again, take your time. Look for that stiff and restricted tissue. Be nice to your lady and help her out. How often do you need to do a pelvic floor massage? It depends. Every woman is different. Every pregnancy is different. So in general though, months 1 through 3 in that first trimester, probably not gonna have to do it all that much. While the baby is growing, the woman typically isn't growing a whole lot. But when we transition into that second trimester, she's probably gonna start feeling uncomfortable and having some pain. So it depends. I'd say maybe about month 4.5, 5, she'll start experiencing some pain and discomfort. And so you're gonna have to experiment. Maybe it's every week and a half, maybe it's every 2 weeks, maybe it's every week. Again, every woman is different. Depends on how fast baby grows. Definitely probably by month 6 and transitioning into that third trimester, month 7, 8, 9, the frequency is going to have to pick up. She may be dealing with pain on a regular basis. So you're definitely probably gonna be doing this every single week by the third trimester in month 7. However, you may need to pick it up as baby gets closer and closer to arrival. This may have to be done twice a week. It could even be done 3 times a week, every other day, really in months 8 and 9 until baby shows up. It's hard to say exactly, but in general, the closer we get to baby's arrival, the more frequently you are going to need to do this pelvic floor massage. So again, you're spending about 5 to 10 minutes per side. You're spending a little more time on the painful side and a little less time on the non-painful side.